In this video, I am again discussing the recall communications, that is a bone marrow aspiration. So how the task come? It is come on 2022. The task is that 3 years old child with huge spleen, liver is not tender, no lymph nodes, no thrombocytopenia, hemoglobin is 5.6, WBC is 3, weak, positive, direct COMS test, no fever, generally well. The hematologist asks you to do the bone marrow aspiration. Talk to the mother about the possible diagnosis and the management. Okay. So we are here to take the consent of bone marrow aspirations. Mother about the possible diagnosis will tell that after examination the diagnosis possibly leukemia, and about management we'll discuss. There is the role player was talkative and keep asking what are the possibilities, what is the cause of hepatosplenomegaly, what are the other possibilities, needs admission or not, is he needs blood transfusions, I can give him my blood. She was feeling guilty that she was late to seek the medical advice. So all the question will answer, like what are the other possibilities, we can tell that after confirmation. That's why we are doing the bone marrow aspirations. And need admission, of course admission is needed. Need blood transfusion, yes, according to blood transfusion needed. One important question, mother is telling that I want to give the blood transfusion, we will tell that first degree relative can't give the blood transfusions, these are. And guilty, no, we will reassure that, no, don't feel guilty. Now I am doing this IRCAP as usual. Introduce myself, making repo, clarify my rule, taking consent, attendance I will ask, and the prior knowledge I will ask. So what is your update about support Linda's health conditions? The doctor, after examining, I am here to know. Mother is telling he has possibly leukemia. Now explanation is like that. As you see that he has a complaint, so we want to know, to be sure that of what behind all this, and as his response to the medications. So we want to know that what is that behind. For that reason, our consultant or hematologist here, hematologist asked to do a test that is called bone marrow aspirations. I am here today to discuss about this bone marrow aspirations, and possibly after the session and this meeting, I will take the consent from you. Like that we'll start. So how the procedure, we'll draw a picture. Can you please follow this drawing? It will be easy to explain to you. So we draw a picture of the bones. We'll use a special needle to take a small amount from the inside of the bone marrow fluid of the pelvis, or called the hip bone, iliac crest. So hip bone, iliac crest, we apply a special needle to take the fluid. After cleaning and putting a new numbness cream inside this bone, there is what we call bone marrow, which is the factory of the doing blood cells. So what happened? We'll iliac crest a bone draw pictures. We'll use a special needle. We introduce this special needle. We'll before that we'll give the clean this area. We give numb this area. The child don't feel any pain. Just inside the bones, we'll collect some fluid that is called bone marrow. And because we want to know that is there any bone marrow is the factory house of the bone cells, any problem here or not. If the communication is about biopsy, just same we tell, but we'll take that in fluid. We tell that some tissue we are taking, or a core of the bone marrow in one piece of bone and marrow. Then check the under microscope. So in bone marrow aspiration, we are telling that some fluid, and bone marrow biopsy we are taking a piece of a tissue, and under microscope we will know that what is the cause. Now, what is the benefit of this test we are doing? Because we will examine the sample under microscope to find out what is the cause behind his complaints, why he is suffering all this, and he may need sleeping medicine if child not cooperative. So, if the child is not cooperative in this procedure, we give them sleeping medicine. Mother can be asked what are the risk factor or the drawbacks. Yes, ma'am, completely understand your concerns. Every procedure, every medicine has there is drawbacks. Here is also, so that is it done with expert team. They deal with any. So pain can be occur, but for pain prevention, we are applying the numbness cream. We give painkiller after that procedure. Bleeding can be occur, but it is can be minimal. We can handle this. We will monitor him catching bug, but doing it in cleaning conditions. Sometimes failure occur this procedure, but our expert team is doing that. They already done that before. So all the complication will and the risk factor will mention, and also what are the steps we are taking to prevent this. We also explain it easily. So mother can be asked, can doctor by mistake enter inside the bone? It is done by expert team and has done in many times before. So expert team doctor doing that. So very rare inside the bone. Alternative, is there any alternative? If asked, no, we need to know that what happened in the factory of blood cells. So we tell that Unfortunately, there is a alternative, but I'm really sorry to tell you there is no alternative, and we also need to know that what is behind that. Is they going to blood? Is he going to blood? We advise to lie on bed and observe for an hour and to check he has no more bleeding. If this happen, usually minor and stop. So after the procedure, we will observe him. Is there any bleeding? We'll check that. If it is minor, if it occur, it will be minor, and we'll stop that. What about the activities? We can return to his activities on bath, swim in 24 hours. So just 24 hours he can take rest. After that, he can come back to the normal activities and the swim. So when result will be released as soon as possible, we will inform you. So it takes maybe 2 weeks, but we will not tell the when result release as soon as possible. When the result is published, I will inform you. Still refuse, arrange another meeting with the consultant, but sooner is better for starting the treatment early. We are telling that we can take another meeting if mother is refusing still with the consultant, but sooner is better. Then we tell the summary, leaflet, support group. These are trusted website leaflet we are giving as usual. If she take the blood thinning medicine and stop like aspirin taking, then it will be stopped. It is an important question. And the mother is very upset that the child has leukemia. If the child is dying, if they ask that, then until now we still suspected the condition leukemia. We are not sure. Even she has leukemia, curable rate is very high. So mother is telling that child has, if possible, diagnosed, confirmed the leukemia, the child will die or not. We tell that let's hope for the best. And modern treatment is already so much improved. If he has confirmed leukemia, then the curable rate is high. Lots of people already curable for this condition. So this is all about bone marrow aspiration, which is come 2022 communications. Thank you.